You're not going to want to miss the next It's Your Health. Dr. Dan and Dr. Dad together talking about food, family, friends.
And Tai Chi.
On the next It's Your Health. Please join us. Welcome back to the fastest 30 minutes in television land out there. Philip Benyo with Daniel Benyo, both MDs and physicians. And that picture was taken right here in this office when it was a barn. And Daniel was, what, 12 years old?
Yeah, it was around that time. Yeah.
Happy to be drug around to get some photo shoots. So I'm sure your kids are the same way now.
Oh yeah, they don't like getting their photos taken, that's for sure.
All right, well, Dan, of course, has his office across the valley over in Cunningham, Lantern Lane, MD, internal medicine. So take it away.
Well, there is a new study, father-baby bonding, it's called. And one of the things that they're noticing is that when fathers kind of interact with new infants through communication, that they've actually have shown that children test better maybe 2 or 3 years later.
Yeah, no doubt. It takes two to raise a family. And of course, today's society, you have both parents working and inavailabilities. So I think it's important that you get that early bonding, just like Dan did when he was growing up, which is why I put my office here, by the way, so they could run across here and give me cookies and milk.
And part of that, during when we used to get cookies and milk, we used to have dinner together, believe it or not.
Right.
And there's a study that kind of showed we may not be eating quite like we used to in the past.
Yeah, exactly. It was supper time. Everyone would be together. We'd have some pizza or spaghetti or some such thing that we'd have a bowl and pass it around. There was no television on. There was no phones that people were texting. We just sat around and talked about the day. And I think that that's an important thing that we've lost, that we only sort of get together now during the holidays, which maybe makes the holidays kind of special. You get food, family, and friends, but we need to get back to that, I think.
Oh, sure, sure. I think that certainly with the family dinner, that kind of goes into some of what we'll talk about later about obesity rates and what have you. And then something very common that I'm sure you've talked about before is high fructose corn syrup. Tell me a little bit more about your understanding of that.
Well, it's cheap, which is why it's in everything. It tastes good, which is why it's in everything. Our bodies have a hard time getting rid of it. And it has a tough way of metabolizing it, so these high fructose foods and drinks pack on pounds that are later then hard to get rid of, contributing to hypertension, obesity, and this epidemic of diabetes. So start reading the labels, and I would avoid that particular compound.
Sure thing, and I think a big picture is moderation is everything. It's pretty tough to eliminate all high fructose corn syrups, but at the same time, less is more in this case.
There you go. I like that.
So compounding on that, you've been in practice almost as old as I am, and tell me a little bit about what your thoughts are on kind of the healthcare landscape that we have currently.
Well, first of all, look at this bill from St. Joseph's Hospital from the early 50s. It's hard to believe that you could be in the hospital that long, have a baby, and get out under $100. And look at that, baby beads were $4 or $2 or something. It's just a different time. But it illustrates the fact that during that time you had a family doctor who would deliver you and take care of you from cradle to grave. Today everything is fractionated. You may have a family doctor who does not go to the hospital when you're admitted. That same doctor may not go to a nursing home when you have to go to a nursing home or personal care home. So right then and there you have different quarterbacks being changed, and it's just the way it is today. Fortunately for our practice, we tend to try to make continuity of care part of your healing, if you will, and caregiving. To the point where we make house calls. I mean, that's it's just part of what we do. And so it's hard for you to understand how the olden days were, but nevertheless, that's kind of the way it was, Dan.
Sure, and just coming online myself, through practicing, I'm seeing a bunch of fragmentation of care where you will have individuals who access different healthcare entities locally, Geisinger, Lehigh Valley, UPMC now coming online. And so we begin to see a patient seeing multiple specialists within different networks, and no one's talking to each other. The electronic medical record, as frustrating as it is and supposed improvements as it should be, they don't talk to each other, and so we have almost over-testing, and I think you're saying is right, that continuity of care is extremely important, especially nowadays.
Right, and with that, communication, that's key.
Mm-hmm. Next on topic, we talked about a little bit about the high fructose corn syrup. And then eating healthy foods. Tell me a little bit about this new study we saw about obesity rates in the United States.
Get a load of this map here. It shows the United States is certainly becoming wider and heavier, and that's translating into healthcare issues. One thing is when I go into the nursing homes and I see people in their 70s, 80s, and 90s, they're not fat. They're all skinny. And so if you want to live longer, you really need to cut down on your caloric intake and get the weight down, because it's not going to serve you well for the future. And you can see where we are as a country in Pennsylvania. I think that little big dot is Hazleton. I'm not sure.
It's possible.
Okay. Well, what are your thoughts?
Well, I think some of it has to do, again, with what we eat, how we eat our dinners with our family, as well as pretty much not being as active as we are. We have these cell phones, TVs. We're a little bit more recumbent nowadays, and so it's a lot of stress on the body, a lot of stress on the joints, on the cardiovascular system, and you're right, you don't see more of the geriatric population being in these larger BMI obese ranges.
Right. And you know, I think the quality of the food is not there. Everything is processed today, and not to knock fast foods out, but nevertheless, we have a society that is not going to sit and make their own tomato spaghetti sauce.
Sure.
It's just very concentrated sweets and fast calories, and throw in there this genetically modified stuff which can contribute to our bodies not being able to process it and causing so-called wheat belly. So moving right along, we've passed the first segment of It's Your Health. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information on Samson Productions. Be right back. Welcome back to the second segment of It's Your Health, the fastest 30 minutes in television land. And bonus points if you can pick out Daniel in that picture, much less me. My God, what happened? That was what, some 35 years ago. Wow.
Yeah.
Where does the time go? Speaking of time, you can bring us into some timely information here, Dan.
Sure. One from the phones, tinnitus causes. Could my antidepressant be the culprit?
Good question. Tinnitus, of course, is ringing in the ears, that high-pitched sound that you hear. It's kind of like crickets, worse at night, worse if it's quiet. It can be medicine-induced. Not very often, however. It's usually a sign of something else. Maybe you have hearing loss and had a high-frequency hearing loss to noise exposure earlier on. Sometimes it's due to high blood pressure. You can actually have a singing in your ears because the arteries that go up next to the ear nerves can create a sound, particularly at night when it's quiet. I would get it looked at and make sure there's nothing else, especially if it's one-sided.
Oh, certainly, and it can affect your equilibrium and put you at risk for falls. So certainly you always want to look through the medication list and discuss with your provider. Next up, we have the influence and benefits of music therapy. We use this in the hospital sometimes where I trained. What is your experience with this?
Well, music there was a quote about making the beast softer or something along those lines. Of course, Dan was involved in musicology in college, so he's well versed with that. There's no doubt that music has a way of hitting certain areas of our brain. For example, I'll listen to some song from the 60s, and out of the blue, it will take me back to a girl that I was dating in high school, and that was our song.
It wasn't Kathleen.
It wasn't Kathleen, thank you.
Well, we won't have her listen to this part of the show.
No, she won't. She won't hear this. But nevertheless, music has that quality. It takes you right back to a time and place, hopefully a good time and place. And I think that's part of the issues. Of course, sometimes it's interesting just to listen to some of the classics on the classical station. It may not put you in a different time or place in the past, but nevertheless it puts you in a good place.
Sure. I think one of the famous quotes is the timeline of our lives. So as you have listened to music when you're younger, you remember those moments, and certainly it always brings up good or bad kind of memories, but it is a useful tool, and in the healthcare setting, I don't think it's utilized as much as we should be using it. Next up, we have Medicare sees almost a not a significant reduction in opioid use.
Well, that is one of the big key words today is opiates use and abuse, and how it's a gateway to other bad behaviors, particularly drug addiction and suicide and drug overdoses. Big problem, and we recognize that and are under scrutiny for the meds we write for. But that being said, we have patients who have severe pain. They may have cancer, they may have had fractures, and the pain management is difficult because in the olden days maybe we gave them a non-steroidal anti-inflammatory agent which has renal side effects, cardiovascular side effects, ulcerative side effects. There's no good answers, and unfortunately the appropriate use of opioids is going to be what we're going to be taking care of, because in the olden days, pain was a vital sign. We took their blood pressure, their pulse, and we measured their pain from 1 to 10. And doctors got sued for not treating pain, and now, of course, we're getting sued for treating pain. So it's a real big problem. Perhaps the issue with medical marijuana may be an out. I've had a couple patients go through that. They feel better. They have less medicine load. And they're happier, so I don't know.
Sure, I don't think there's an easy answer, and pain is certainly personalized, and so always an individualized approach is important. And I think some of our hesitancy as providers, at least on my end, is when I'm seeing legacy or large doses of opioids that were maybe more common in the past, and now I'm trying to titrate down these medications to a safer profile, and it's deemed as being the patient's bad, or there's some ill effect towards it, and it really is just more of a safety concern, and it's something that you kind of personalized and try to attempt to get them to safer doses over a long period of time.
Yeah, no good answers, but we're trying.
Yeah. You do geriatrics, and a lot of what we see, we talked about dizziness with medications. Here was an article that I read through talking about earwax in the elderly.
Yes, I'm becoming a client in my geriatric practice, by the way. I was down at Social Security already signing up. But don't get any ideas, I'm not retiring just yet. But nevertheless, earwax is a big issue. I generally check ears every time I see a patient. You'd be surprised. We actually find bugs sometimes in there. I'll never forget a case where a girl was referred to me because she was coughing all the time, and the doctor said, I think she has TB. And here, as part of my exam, I examined her ears. There was earwax. I removed the earwax. The cough went away. She didn't have TB. It was a foreign body, if you will, because there is a nerve in there that even when we're removing earwax, people will cough. But it can cut down on hearing. Could be a source of infection, and sometimes is easily removed, sometimes not. You have to use a lubricant to soften it up, and then we wash it out. It comes out like butter. So a common problem that can cause common illnesses.
Oh, certainly. And it's a non-invasive approach to kind of treating the patient and can resolve a lot of symptoms.
Right.
Also, that is a non-invasive strategy to improving elderly with falls. A study that I read was about Tai Chi in the elderly. Now, do you practice Tai Chi?
What is it?
Some form of karate, I think.
I'm not there yet.
And so it lowered their risk of falls. The group that maybe did, they enrolled two groups. One group that didn't do the Tai Chi, that just did resistance training, exercise, walking. Another group that did Tai Chi with the addition of the exercise. They found that there was a 50% reduction in falls when they looked over a couple-year period. It was pretty impressive.
Yeah, and I think that's the bigger umbrella is physical therapy. I think our seniors need to be physical. Tai Chi is one of those things, physical therapy. But I think you got to move in order to maintain.
Sure, sure. And then lastly, we touched a little bit on this earlier in the segment, was about pain medication, opioid use. A study that I read across, as well as you did, was the use of NSAIDs and increased mortality.
Yeah, unfortunately, people who are taking the Nuprins, Advils, the non-steroidal anti-inflammatory agents do at a great peril. They have shown increased stroke, heart attack risk, to say nothing of irreversible kidney disease. So that's a tough one. They don't really advertise it or tell you about it as much, but they're not really a safe drug. But it is safe to keep watching It's Your Health, and we're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the third and final segment of It's Your Health. We're doing Disney there, Dan.
I know, the memories, wow.
Like an old song, isn't it?
It was beautiful.
Yeah, it was great growing up.
So more to the headlines. One is fibromyalgia, very common, something that we see throughout our day. They're saying that maybe it should be considered as one diagnosis, not two.
Right. Well, just to back up, fibromyalgia means painful muscles. We see a lot of this. It's a disease of unknown origin, hard to treat. See it in younger women, quite honestly. It's often associated with a sleep disorder, which can evoke periods of anxiety and depression as well. And usually we try to treat the biggest symptom that these patients suffer with. It is a disabling illness. In other words, I mentioned Social Security earlier. Fibromyalgia is one of those illnesses that can disable you, assuming that you have it and you don't have anything else. And it's important to, if you're going to be diagnosed with that, to exclude other illnesses, Lyme disease, rheumatoid issues, things along those lines. But nevertheless, that's what this article was getting at, is that there can be other illnesses that can be fibromyalgia-like. And I think what the idea is let's just lump them together, make it one disease, and treat one disease, assuming you don't have anything else.
Sure, very difficult disease to treat, and it can wax and wane throughout the holiday season, especially as well as in stressful times. And usually environmental factors help improve it, increasing exercise, watching your diet, and kind of modifying what you're doing to yourself, smoking, those type of things as well.
Doing Tai Chi. Tai Chi.
We'll get it before the end of this segment. So next up, overactive bladder. Very interesting finding with diet and some of the risks of what we ingest and causing these symptoms.
Yeah, we see that, of course, it's generally an overactive bladder in women, and that can fall into various categories of symptoms. You may have some incontinence, you may cough and leak, you may have to be running to the bathroom all the time. You want to make sure you don't have diabetes or something pathological going on in your bladder, like an infection or a stone or a tumor. But interesting enough, if you look, there's a number of medications that were listed there. We'll list them on the full screen for you. And here's some of the things you may need to do is to cut down on carbohydrates, caffeine especially, limit alcohol, artificial sweeteners, and get into more vitamin-rich diet.
Sure. I think one of the big hallmarks too is states of dehydration and irritation of that bladder wall. It's always important to rule out infection, as that's treatable, and keep your hydration up. Caffeine is a diuretic, so that can cause very concentrated urine. Artificial sweeteners, smoking, stress as well. Always talk to your provider if you're experiencing these symptoms. And I think it's a difficult disease to treat, but it is somewhat treatable. I wouldn't say it's curable, but certainly managing symptoms is important.
Yeah, and the medications can sometimes cause more side effects than what we're treating here. You know, dry mouth, lightheadedness, dizziness. Tough thing to have.
Yeah, no, certainly. Next up, with our tinfoil hat question, I guess, is calling in about Colonic Cleanse. There's an article as well about a Canada cleanse. Have you heard of this?
You have to go to Canada? You know, it's kind of interesting. There's some fad things out there that think you have a cornflake that you ate in high school sitting in your colon causing trouble, and that's just not true. We don't see those on colonoscopies. So there are some issues with our bowels, and some people can magnify those issues into more physical symptoms. And they think, well, if they can cleanse their bowel of a yeast or fungal infection, which is not too far-fetched, because with antibiotic use in our diets, you probably could have some type of bowel issues, but cleansing the bowel, I'm not sure is appropriate. There are bowel bacteria that belong there. Perhaps just making sure, again, you don't have anything else. Get up to date on your colonoscopy screens. If you don't want to get a colonoscopy, go for the Cologuard testing, which can screen for colon cancer in the privacy of your home. So I think making sure of the proper diagnosis may lead you to a proper treatment.
Sure, and you don't want to miss something significant. And maybe sometimes the diagnosis is, are we playing into kind of that fibromyalgia component with an IBS, irritable bowel syndrome? Also, are we having maybe a gluten intolerance? That's somewhat of a controversy of whether or not the severity of that. And additionally, like you said, the bowel flora kind of outnumbers us. There's billions of it. And keeping good bowel flora health is important. Eating yogurts with cultures in it. And interestingly, there was a study that showed when they did bowel or fecal transplants, as this may be disgusting or turning off as that is, they transplanted thin people, normal weight bowel stool into an obese individual, and they actually lost weight. Wow. Believe it or not. So it's pretty interesting stuff. We're still determining about bowel health and overall flora. I think there's a segment that we do here about picture quizzes. Very interesting quiz that I ran across that came with, I think, a 19-year-old gentleman who had a lesion on his cheek for several weeks. It grew in size very slightly, and it was red, didn't have any drainage, he didn't have any fevers. His mom kind of said, well, what are you doing about that? And he said, I don't know, and looking at his cell phone, of course, and ended up coming to the doctor. And what do you think about that?
Well, get a load of that picture. It's something you don't see all the time. You know, it looks like an ingrown hair or a pimple. Put some black salve on it and see if it goes away. But it illustrates an interesting point about medicine sometimes. This was actually a dental issue, right?
Very interesting. It was a dental abscess, a periapical abscess that kind of was eroding and going through to the skin, which, if left alone for a long time, it would cause a disaster almost.
Right, and I think the take-home message here is we talk a lot about medicine. Your dental health is equally important, and make sure, you know, we take great pride in giving him fluoride when he was growing up. All those pictures you saw, he was getting fluoride to maintain his health, and went to his dentist and has a nice smile now as a result of that. And if you neglect your dentition, your dental health, you're really looking for trouble on down the line. So it's an important concept to make sure that you keep up to date on.
Oh, sure. Has been a long-standing factor of poor dental health, poor health in general.
Right. Well, you're not going to get poor health by watching Itchier Health, right? Because we talk about Tai Chi here as well.
Excellent. We nailed it.
So thank you for allowing us to come into your rooms and entertain you and hopefully inform you as well. Dr. Dan with Dr. Dad, and we'll see you next time on It's Your Health. Thank you for joining us.